Correct. So this is about the increasing number of spectacles. But if we have to talk about, are there any permanent damages to their eyesight or eyes in the long run if they have long hours on screen?
So most current research does not suggest that screen time itself by itself causes permanent damage to the eyes.
Okay.
But children who have heavy screen time generally tend to have a faster progression of nearsightedness or myopia.
Okay.
And because it progresses faster, we have to keep an eye on them, do frequent eye checks. If the number changes very frequently, then we should think of something called as pathological myopia,
Right.
which might lead to other issues later on.
But also we had been hearing this since years now, that if you have a bigger screen time or long hours on screen, your spectacle numbers will also increase, and that is what we had been telling our children also. So what is your say on that?
So what I would say is screen time does not directly cause permanent damage to the eye, but what screen time contributes to is worsening myopia, especially in children. Also, there is a stress on near work, which also contributes to worsening myopia, either basically a higher progression of that myopia. And if a child already has myopia, then obviously it is progressing faster if there is heavy screen use. So reducing that should definitely be a priority. More importantly, if a child has myopia, they should have eye checkups done regularly.
Right.
If their number changes frequently, then we have to be on alert for something called as a pathological myopia, which puts them at risk, especially later in life, of retinal problems, which we have to watch out for and treat.
Okay, so doctor, my next question is, as a mother, this is something which concerns me a lot. So, do you feel that children and teenagers are at a higher risk because of these online classes and more mobile and screen usage nowadays?
There definitely has been an increase in kids' screen usage nowadays, and though people are very keen to attribute it to online classes, I would say that there is a fair bit of offline, in the sense, online presence which is not related to schoolwork.
Yeah,
Teenagers
other than
maybe
classes
to
also their screen
Yeah.
time is little high.
Teenagers maybe somewhat, but for kids, they as well have a lot of screen time, which is definitely not due to online classes.
Yeah, true.
And it is very hard for parents to keep the screens away because kids always want more screen. They
Right.
tend to be focused on the screens, giving parents some respite. So there will be all those busy, naughty kids that the parents will want to have a little bit of screen time so they can catch a break.
Right.
But at the same time, it is important to know what are the risks associated with that. And children have different risks associated with screen time as opposed to adults. Children generally don't develop dry eyes that easily, but prolonged contact, prolonged screen time can cause dry eyes in children as well. Discomfort, irritation, they will rub their eyes, all these things can happen. More importantly, we have something called as nearsightedness or myopia progression associated with children's screen time.
Yes.
So what has happened and has been noted by several studies and is that myopia or nearsightedness, the incidence and its progression as well has increased a lot in recent time, and this is because we have seen a sudden increase in screen time, especially during the lockdowns.
Right.
And during that, the rate of myopia that we calculated, the progression of myopia was definitely increased. Nearsightedness increased in kids. And this is mainly because they are doing as such a lot of near work. Even kids who are very young will go to play groups, will do a lot of near work. Older kids will also, I mean, in addition to screen time, near work is also much more in kids. What this means is that they don't often go out, play in natural light, do outdoor play, which involves looking at a lot of distant objects, and are often indoors doing a lot of near work, seeing things at near. So they tend to focus at near and do not tend to see things which are further away,
Right.
and this can cause myopia progression. So one of the remedies.
I think this is again something which I had been hearing a lot through all the parents now. So when you talk about myopia progression, are there some remedies also? Is there something which we can keep in mind as a remedy for that?
So for firstly, we will cover later what are the screen time recommendation, the hours recommended by important children's bodies involved in children's health, like the American Academy of Pediatrics. We actually have recommendations to that. Second thing is the focus on near work should reduce a bit, especially for younger kids. Try to give them a lot of outdoor time, especially outdoor play time,
Right.
where they are in natural light,
Which
looking
is
at
actually
distance.
reducing nowadays.
Yeah, which it is difficult for parents to take them in an outdoor play area or place where they can play in the outdoors in natural light, but that definitely helps kids.
Correct.
And that definitely prevents myopia progression, outdoor play and looking at distant objects.
Right.
So those are important things. Other than that, make sure that whenever you give them any screens to use,
Yeah.
they are sitting properly, have good posture, there is enough light, there is not glare on the screen which is irritating them.
Yeah.
So all those things will help quite a bit.
But also we had been hearing this since years now, that if you have a bigger screen time or long hours on screen, your spectacle numbers will also increase, and that is what we had been telling our children also. So what is your say on that?
So what I would say is screen time does not directly cause permanent damage to the eye. But what screen time contributes to is worsening myopia, especially in children. Also, there is a stress on near work, which also contributes to worsening myopia, either basically a higher progression of that myopia. And if a child already has myopia, then obviously it is progressing faster if there is heavy screen use. So, reducing that should definitely be a priority. More importantly, if a child has myopia, they should have eye checkups done regularly.
Right.
If their number changes frequently, then we have to be on alert for something called as a pathological myopia, which puts them at risk, especially later in life, of retinal problems, which we have to watch out for and treat.
Right.
So, those screen heavy habits do not directly contribute to myopia progression, but in patients who already have myopia, if they develop something called as pathological myopia, this could lead to issues. So it is important to screen kids, have regular eye checkups, and to some extent also restrict screen time, because this will prevent the progression.
Correct. So this is about the increasing number of spectacles. But if we have to talk about, are there any permanent damages to their eyesight or eyes in the long run if they have long hours on screen?
So most current research does not suggest that screen time itself by itself causes permanent damage to the eyes.
Okay.
But children who have heavy screen time generally tend to have a faster progression of nearsightedness or myopia.
Okay.
And because it progresses faster, we have to keep an eye on them, do frequent eye checks. If their number changes very frequently, then we should think of something called as pathological myopia,
Right.
which might lead to other issues later on. So the treatment for that is fairly simple. More outdoor time, more breaks in between screen time, and those proper viewing distance and timely eye checks. So these are the things that will reduce their risk of developing something major.
So the next question is, again, I think everybody wants to know. So as an expert, what is your recommendation? What is the ideal amount of hours, for screen for adults as well as for children?
Okay, so screen time in children has been studied quite a lot since the time of lockdowns in COVID, because there was a lot of screen time then.
Correct.
And there are actually recommendations from a number of governing bodies like the American Academy of Pediatrics. So the initial recommendations were children under 2 years should not have any screen. But now those recommendations are somewhat modified. So under 18 months to avoid screen media except for video chatting with friends or family, and 18 to 24 months, some kind of high quality content with a caregiver. Then 2 to 5 years, about an hour daily of non-educational screen time is okay. Ages 6 and older, there is no single number which sort of fits everything, but a reasonable amount of screen time with breaks,
Right.
and especially with regard to school timings and sleep is much
Right.
more important
Right.
than just a number. Okay, for adults, we don't have any kind of ideal number because we differentiate between something like work-related screen time, which is unavoidable, and leisure screen time for adults. But ideally, if you're spending a lot of time on screens at work, then your leisure screen time should ideally be less than 2 hours.
Right.
But rather than just chasing a perfect number, you should uh, try to get enough breaks, adjust your posture well, get enough sleep and exercise, and those things are much more important than just the number of hours you're spending on the screen.
Right.
And though I would say ki do not completely discount the number of hours you're spending on screen, because even some reduction is helpful. So yeah,
For sure.
so definitely that's there.
Right.
And for children as well as adults, what you're using the screens for is much more important.
Yeah, the content is also very important.
Yeah. So are you using it for some kind of educational use, social connections like video calling or such, work? These are all different from endless scrolling or
Correct.
late night watching, which are much more likely to disrupt both your sleep and your health. And for eye health specifically, long uninterrupted near work is much more damaging. So taking frequent breaks, making time for sleep, exercising well, as well as good posture are very good important things that you should take care of.
I think this is 100% going to be very useful. They are going to have clear idea about, hours are important, but more than hours, the purpose behind using screen is also very important. So I think, and also the difference between using the screen for work and for leisure are two different things.
Absolutely.
So that was very, very useful. So thank you for such, amazing tips. But still, I want to ask you one more question related to this. What are some simple habits which adults and children, everybody can adopt in their day-to-day lifestyle? People who are people like who are using screen for a longer time, maybe computer, maybe mobile. So what are the simple habits they can adopt?
So there are some simple habits that people can adopt to protect their eyes daily while using a lot of screen. So one of the important things to do is cut the glare. So there is glare coming. So for example, you're sitting next to a window, there is a lot of light coming. It's casting some light on your screen and that is causing glare. So reduce that glare. When it is due to some natural light coming from the window, get some shades. When it is due to very high, very bright overhead lighting, try to change that. If you still need a light, use a desk lamp which is at the appropriate brightness or contrast that suits you. Backlight is also good, but you have to see what suits you well. And do not go by the same factory presets that are there on your monitor or your screen as well. Adjust your font size, your brightness, your contrast. All of these things will help to reduce strain on your eyes.
Right.
Other than that, just take a break for some time.
That's
So
the
we-
basic you can do.
Yes. So the 20-20-20 rule that we talked about, every 20 minutes, take a 20-second break, look at something 20 feet away or roughly 6 meters away. That will help to relax your eyes. Other than that, you can have some simple daily routine to follow. You can take a warm washcloth dipped in like lukewarm water and put it over your eyes. This helps your eyelid glands to release secretions, which helps to prevent dryness
Right.
and treat any fatigue or discomfort. You even get gel packs which serve the same purpose, so whichever
Right.
suits you is a good
Right.
thing. So, one more thing I would like to highlight in the habits that we discussed about is something called as presbyopia. So, what is presbyopia? After 40, roughly your eye muscles become a little weak. So, initially you can focus very well for distance as well as for near.
Right.
But as you go over 40, not like exactly at dot age of 40, but maybe around 40, you find that reading something or seeing something at near becomes difficult,
Yeah.
particularly small writing. So this is because your muscles which do the accommodation that helps you to see better are becoming weaker. So then you need additional power in your glasses to see things at near. Nowadays, you have contact lenses which also serve the same purpose, which takes some time to get used to, but those can be used as well. If you are very tired from using contact lenses, shift to glasses, and you have to get your power adjusted by an eye surgeon or an optometrist who will give you the correct power. So remember to get this power checked.
So thank you so much, Dr. Shalmali. Here I come to the end of the questions, but we never end our episode without getting the amazing tips from the expert. So what are the top 3 or 4 tips you would like to give it to our audience, which they should follow every day?
Okay, so the top 3 eye care tips for people who spend a lot of their day on screens are that try your best to reduce your screen time. However much it might help, try to reduce it. And in addition to reducing, you can even give longer breaks, more outdoor time. Uh, so all those things help. Second tip is follow the 20-20-20 rule, which is every 20 minutes, take at least a 20-second break and look for something 20 feet away. And the third rule is if you have any kind of persistent symptoms like a headache, eye discomfort, redness, double vision, do consult an eye specialist.
Awesome. This is very, very useful, and I think it's very simple to adopt in our day-to-day life. So thank you so much. Here we come to an end of this beautiful session, and I'm very sure today's topic was very, very useful and interesting. So thank you, Dr. Shalmali, for accepting our invitation and being here with us today. Thank you so much. Don't forget to, subscribe the channel, like the episode, because we are again going to come back with amazing episodes, yet more interesting episodes and videos. So stay tuned. Don't forget to subscribe our channel. Don't forget to like this episode, because we are again going to come back with even more interesting episodes and videos. Thank you so much.